Hello, I'm Kate Shepherd. I'm one of the clinical nurse specialists for conservative management. About 1 in every 5 patients with kidney disease decides not to have any of the replacement therapies, but they still receive active care from our healthcare teams. This is known as conservative management. People sometimes choose this option as they may already have a range of other illnesses, and as a result, starting dialysis may not improve their quality of life. In certain situations, dialysis may not lengthen a person's life, so instead they opt for symptom control provided through medication and diet as necessary. Sometimes life expectancy will be more limited with conservative care, but may be the treatment of choice because patients often have a significantly better quality of life than other frail patients who choose dialysis. Patients choosing conservative management also tend to have fewer hospital admissions, for example, from dialysis-related complications, and are more likely to pass away at home rather than in hospital. This particular option still requires active management of the complications of the kidneys not working properly. Choosing conservative management is an individual decision which should be made after weighing up the advantages and disadvantages. It is important to talk with your medical team and your family and friends about what is important to you and your quality of life. If you decide that you do not want to pursue dialysis or transplant, you and your carer will be supported by nurses, doctors and counsellors based at the hospital and in the community. We will continue to protect the function of your kidneys and keep you as well as possible for as long as possible, but over time it is likely that you will become more unwell as the toxins build up in your body. No decision is set in stone, and it may be that you change your mind. We will support you in any decision that you make. However, if you change your mind and you are starting to feel unwell, you may need to start dialysis immediately.
This is Ted, whose relative Arthur decided that dialysis was not for him and chose to follow the conservative management pathway.
Arthur was first informed in March 2004. A senior nurse from Guy's came to his house in Orpington to advise him that in fact his kidneys were going downhill, and although he wasn't at the point of needing dialysis at that moment, it was coming up on the near horizon, so it would be soon. When he was informed that his kidneys were beginning to fail, Arthur was then 80, and he had at that age quite an active life really. He enjoyed going out with his friends to lunch, he enjoyed going to his church, to his Thursday afternoon club, and he felt that in fact that by opting for dialysis, all that would have to go. And without dialysis, although it might mean a shorter period of life, he felt that he would have a better quality of life because he would be able to sort of carry on as best as possible with his normal things, and that is what happened. I understood the decision because I knew Arthur, and I felt that the way that he put it, that it was a decision that he made, and I felt sure it was the right decision for him. After Arthur had made the decision, the care that he had was brilliant. I know it was the right decision not to start dialysis. I know the treatment may extend my life for a short period, but I've had all this time with improved quality of life, and I'm happier as a result of the support I'm now receiving. It's not about the treatment you receive, but the way care is delivered. I'm reviewed regularly by a nurse specialist. He could ask anything that he wanted, he felt happier about it. The normal process is that I will die one day, but the support I've had from the Renal Palliative Service means that I no longer worry about it.
There are a number of things to consider with conservative management. People who consider conservative management often have a range of other illnesses and feel that dialysis will not improve their quality of life. Therefore, they decide to have symptom control despite the fact that their lives may possibly be shorter. Choosing this option will usually mean fewer hospital admissions, as well as continued support and planning for the end of life.